So I'm hoping to get them back up on your screen. It's a few technical difficulties there. I know they're there, but they should hopefully come up. You saw their pictures there. Well, there you go. There's Councillor Georgia. Hello, good morning.
Hello, hi.
And there is Professor Kevin. Good morning, Professor. How are you?
Good morning, good morning. I am well, just recovering from a bit of a laryngitis, but really looking forward to the talk this morning, and congrats everyone on this amazing conference.
Brilliant stuff. What we're going to do is get yourself and Councillor Georgia together, and I'll get out of everybody's way eventually, and then you'll be able to get into the first session. But just as a reminder, this is about making sure we're creative and innovative about how we come out of COVID-19 as Londoners, as London organisations, and make sure that those actually who have been disproportionately affected by COVID-19 have the access and have the ability to make sure that they can access the things that they need to the levels that were pre-pandemic. So hopefully Professor Kevin and Councillor Georgia will be able to do that soon. Councillor Georgia, I think if we can just look first of all and just see, what are some of the challenges that still lie ahead. We are coming out of this pandemic. We are on the other side, I'd like to think, and as London starts to begin to return to normal, there are still elements that need to be addressed. And for you, what do they look like?
Yeah, well, thank you so much for having us at this conference. It's great to be here with Kevin as we've worked so closely together during the pandemic. And I just wanted to start by echoing Gillian's words, because I think that the whole sector has shown just an extraordinary effort to respond to COVID, both kind of pivoting services online and continuing to support people into physical activity. And then over the last few months, opening up leisure facilities and making them COVID safe. And I know I get so many emails from residents saying how much they appreciate getting back out there and supporting services. And I was talking to my husband this morning, and he looked at me a little bit skeptically when I said that I'd be speaking at this conference, because he's struggled sometimes to get me to go on our daily walk. And I remember I once joined a gym which was at the end of my street, and then used to walk a kind of 10-minute walk home in order to avoid looking at this gym, because I felt so guilty about not using it. I think I went once. But during the pandemic, I think, like many Londoners, I didn't have a garden, and I think really started to appreciate just how important physical activity is, and both for your mental and your physical well-being. And when many of us are sitting in Zooms like this all day, moving is so critically important. So I think COVID has kind of taught all of us how important this is, but I think it's also shone a real spotlight on the inequalities that we have in London, and the depth of those inequalities. And I know Kevin is going to talk after me about some of that and the depth of that. But it's something that we've really seen, because for some Londoners, they could do online classes, they could exercise in their garden. But I know for many of my constituents, they didn't have that digital access, and they live with severe overcrowding, and being able to access just the space to exercise was incredibly difficult. And we see those barriers. And I think local authorities have a critical role in tackling those inequalities. I think one of the strengths of local authorities is the depth of our networks into communities. I know in Camden we have over 300 local sports providers who are really rooted in communities, often led by citizens. And that trust, that local connection is so important to getting people into sport and activity. And as we look forward to recovery, which is what this session is about, we want to ensure that the sport and physical activity sit at the heart of COVID recovery in London. I co-chair London's Recovery Board with the Mayor of London, and we're setting out some ambitious missions to support London's recovery, such as doubling the size of the green economy, supporting young people to deal with the pandemic, and helping reduce the number of Londoners living with an unhealthy weight. And whether those missions are about supporting young people, supporting high streets, mental health, or healthy weight, I think sport and physical activity sit at the heart of all of those, and are deeply linked. Because, as I said, they support mental health and well-being, they create great jobs. Our high streets should be places where people can walk and cycle and have easy access to good quality leisure facilities. And as we think about the mission, I think that's kind of most closely connected, which is supporting Londoners living with an unhealthy weight. We're going to be focusing on making it easier for children and their families to access healthy food and drink, and to build physical exercise into their lives. But we know that those living in some of the most deprived parts of London have some of the highest barriers to good health. So some of the programmes that we're looking at London-wide are supporting water-only schools, tackling the advertising of food high in fat, and helping to shape the environments that children live in. And there's been some really powerful work to support healthy school streets, or super school zones, as some places call them. And we know that people who are physically active are 3 times less likely to experience depression than people who aren't. And children who are physically active do better in school and will be healthier as they grow up. But we know that still many Londoners do face huge barriers. 65% of adults and 41% of children and young people in London are physically active, which is slightly lower than the England average. But we see huge variations in London. In Richmond, that's 73%, and in Barking and Dagenham, that's 53%. And that's no reflection on the services there, but it is a reflection on poverty and the barriers that poverty can put in place for people being able to access physical exercise. And that can be living with stress and anxiety, often exacerbated by deprivation and debt. It can be lack of affordable and reliable childcare, not having easy access, as I've said, to places to exercise, experiencing barriers because of disability, and barriers related to poverty. So there's been a lot of work the local government are doing to try and address that, using the planning process to ensure there is access to green spaces, incentivising physical activity. I know Hounslow and Greenwich are partnering with local businesses to provide discounts to residents who exercise or join public leisure facilities, which helps the local economy and gets people into sport. But I think, as I said, some of the most powerful work is the work with local community groups and grassroots organisations. One example is Coping Through Football, a programme run by London Playing Fields Foundation and Leyton Orient Trust, which supports young people and adults who cope with multiple complex challenges to make social connections using football as a therapeutic intervention. And sport, we often see is a way to connect communities, to bring people into wider services, and can be a language that connects people from all different walks of life. And we know that local authorities have a really important role in ensuring that the leisure activities are affordable and accessible. But I think we've also learned a lot from COVID. I think we've seen that for some people, actually having an online offer has opened up sport and leisure in a different way. And we know that despite the digital divide that I talked about, that has been critically important. I think there's been a huge amount of innovation through COVID, and I think we want to continue to build on that and to learn from it. But I think we've also seen the huge financial challenge that we've faced during COVID. A lot of those grassroots sports organisations that I talked of have had to close for long periods, have lost their funding, and are really facing a critical situation. And we know that we've lost an estimated 600 million of revenue for councils associated with leisure during the pandemic. So the financial situation is really difficult. And there's a huge need for investment in leisure facilities. I think nearly 2/3 of leisure services are ageing and urgently need capital investment. So I think that one of our big messages to government, and the spending review is just coming up, and hopefully this is a really good time to make this push, is to use this as an opportunity to really invest in community services, in those grassroots organisations. And we talk a lot about investment in the NHS and in adult social care, which is absolutely critical. But I think equally important is investment in prevention and community support. It's the kind of third pillar of those services, and it needs the same level of investment, and leisure and activity are a huge part of that. So I'm a chair of London Councils, and in our spending review submissions, we've asked for an increase of 5% each year into leisure and sports in London and in the rest of the country. So I think that there's some things we need government support from, but there's a lot we can do together. We have a really strong baseline of services. I think we have a renewed appreciation of the importance of physical activity, and I think it will be absolutely critical to helping individuals recover, to supporting well-being and health. So I hope that the work we're doing London-wide can enrich the local offer and can create a really strong mission that brings all Londoners together to support a more healthy city.
And we can see here that you're about to show us a presentation in terms of reconnecting and rebuilding and making sure that London is at the focus of that.
Great, thank you, Jeanette, and good morning, everybody. It's such a pleasure to be here with you this morning, and let me begin by apologizing for my voice. Those of you who've heard me speak before know that my tones are a little bit more dulcet than this, but I have been recovering from a laryngitis. But I was keen to be here this morning, first of all, just to say thank you. Thank you to all of you for the work that you've been doing over the past 20 months throughout the course of the pandemic to ensure that the lights were kept on with our physical activity and sports activity, and that during some of the darkest days of the pandemic, of lockdowns, of restrictions, that you worked together with local authorities and local communities to ensure that there was an offering for physical activity, that there was an offering for sports events, because this was critical and essential in helping to get all of us as Londoners through the pandemic. And if I reflect on my own health and well-being, in some of the toughest times, most stressful periods that we had, whether it was going out for a walk, whether it was when the gyms were open, getting back into my gym routine, or whether it was participating in community events online, all of these were really important in helping me, and I know millions of others, to get through the pandemic. So let me begin this morning by saying a huge thank you for your sector, for your work, and for your leadership. And I hope that as we start the process of rebuilding and restarting and reactivating London and our society, I am committed to working with you all to ensure that physical activity, this magic drug that we often speak about, is part and parcel of the rebuilding of our city, encouraging Londoners to become more healthy, more active, to use physical activity for mental, physical, social, and spiritual health, which is a key part of our well-being. So I have a few minutes this morning. So what I want to do is three things. The first is really just to step back and to look at the pandemic in context, just to share the journey that we've been on and how difficult and painful it has been, but also some of the lessons that we're taking away from the pandemic. And second, I'm going to reflect on physical activity, what we knew before physical activity, before the pandemic, in terms of the importance of physical activity, and why, as we emerge from the pandemic, physical activity must be a key pillar for our work with communities, physical activity and sport. And then finally, I'm going to reflect a little bit on what we can do together and what the recovery landscape looks like and what some of the opportunities are for us to truly capitalize on physical activity. So, we are emerging from nearly 20 months now in the pandemic, and without doubt, COVID-19 has been the biggest health and care challenge that the system has faced in living memory. And it really is essential that we all learn from this experience, both the good and the bad, what didn't work, what has worked. And we also must recognize the contribution of millions of workers, volunteers, and staff who really worked with helping us to both respond to the pandemic, to transform services from in-person to online and digital, to really think about how we bring communities to the center of the response, but also how we tackle inequalities as well. And the inequalities have been a key feature of the epidemic. When the story is told of the pandemic was never a great leveler. But what the pandemic did was to highlight systemic and long-standing inequalities within our society, and in many instances made them worse. And publications from Public Health England, from ONS, from now academic researchers over the past year confirm that the disparities in risks and outcomes in COVID were seen by age. So the older you are, the worse your health outcome. By geography, we know that London was particularly hard hit by both wave 1, 2, and most recent wave of the pandemic. And that people who lived in the most deprived parts of our city were far more likely to be infected and to die from the disease. And of course, significant variations by race and ethnicity as well. And these disparities are not new, and they could have been predicted, and they were predicted for the pandemic. And we have been working with you all over the past 20 months to reduce the impact of the pandemic on these inequalities so that we emerge stronger and we're leaving no one behind as part of this pandemic. We learned many things over the last year. We learned the importance of occupational risk, for example, on determining your likelihood of being infected with COVID and developing severe disease. And I think one of the things that I hope will remain with us is a deep appreciation for key workers, a deep respect for the people who helped to keep our city running in the darkest days of the pandemic, whether people working in shops, the hospitals, social care, transportation, that allowed us to continue to work. And we know that these populations and these occupations were severely affected throughout the course of the pandemic. And thankfully, these risks are now a lot less because we've learned more and we've been able to put in mitigations. But again, these are lessons that we've learned. And as we think about recovery, it's about how do we take care and engage those populations, those occupations who may be at poor risk of both lack of physical activity, but also poor health. We also learned about the importance of household size and composition over the past year, that actually we knew this, that overcrowded households, that multi-generational households could put us at risk of a range of poor health outcomes. And COVID demonstrated that even further. So the larger your household size, the increased risk you had of developing COVID and having severe disease. And of course, we know that this difference in household size and composition varied by your social status, economic deprivation, and race ethnicity. And all of these factors helped us to understand where we need to engage and how we need to engage communities differently to reduce risk. So stepping back, when the story is told, we will have had millions of people who were affected by the pandemic. To this day, we know that more than 7 million people tested positive for the coronavirus. And sadly, we've lost more than 130,000 people, or family members, or neighbors, people, or colleagues across the country. And London certainly has had a disproportionate impact, both of infections as well as deaths. But emerging from the pandemic, as I said earlier, are key lessons that we must take forward and must inform as we recover and as we rebuild. And these lessons are really critical because it means for our health and care services, as we recover and restore those services, we can't and mustn't go back to where we were before, because we know that where we were before with health and social care was not working for all of our communities. And in fact, COVID helped to highlight those disparities. And therefore, it is incumbent on us, those of us working in health and care systems, that we are clear about the importance of addressing inequalities as we recover, as we develop and design services, and as we deliver them in communities. Equity must be at the forefront of our thinking, not as an add-on. And what does this practically mean? Well, some of the things that we're doing across the NHS and with local government are highlighted on the left-hand side of this slide. putting the workforce at center stage, recognizing that if we take care of our workforce, equality, diversity, inclusion, and well-being, then we have the credibility to go to our communities to talk about our hopes and dreams for their well-being. As I mentioned, we need a step change in addressing inequalities and population health, and that work has already begun in London, and we will continue to take that to the next level. It means arguing for and advocating for lasting reform of social care and ensuring that all of the digital innovations that we've had over the past 20 months become part and parcel of how we develop services and we deliver them at scale. But we also understand that digital inclusion is equally important as we develop these services. And finally, it means that all of the work that we've done over the last year to work more closely with communities and to build trust between communities and public services and to engage on conversations, whether on the vaccine or inequalities or access to care, those are assets and keys to success that we must take forward with us. It also means that we need to look differently at health promotion and physical activity as well, because the pandemic has shown that actually, if you were in poor health, if you had poorly managed long-term conditions, then you were more likely to have a range of severe outcomes with COVID and death. So the health promotion implications from the pandemic are also clear as well. And health promotion will need to think differently about how we look at the needs of different communities and different areas of health. And we are deliberate in developing and delivering services to address these. Again, no one could have predicted over the past 20 months that the focus on our mental health and well-being would have been such a core and defining feature of the pandemic. But now all of us know about the importance of tackling inequalities, the importance of addressing our mental health, and the importance of improving physical health. And that's where physical activity becomes important. It's important that we also look at the innovations in helping people to get healthier. Digital offers new ways in which we're connecting with communities as a key part of building into the future of our health promotion systems moving forward. And again, I'm keen to hear from you about what innovations on physical activity and community sport will you be taking forward, and what help do you need to ensure that that takes place? Now, physical activity is critical. Now, those of you who've heard me speak before have heard me refer to this as the wonder drug. If there was ever a drug that I could package, give for free, at scale to everybody in the country, it would be packaging physical activity and encouraging everybody to be more active. But we know pre-pandemic that levels of physical activity varied significantly across our society. Only 1 in 4 women and 1 in 5 men in England were classified as physically inactive, doing less than 30 minutes of moderate physical activity per week. And that difference is seen in different types of activities. So we know that 1/3 of men and nearly 1/4 of women undertake muscle strengthening activities on 2 days a week. And we know that sedentary behavior, which is also a risk factor for poor health, was also a challenge for us in the city and nationally as well. We know that there are significant differences across our city. When we look at the proportion of people who are physically active, we see significant variation across different parts of the city. And in terms of what we observe, London is the 3rd highest of regions in England for physically active adults. We want to have an ambition to increase that. Why shouldn't our city be the most physically active region in the country? And within our city, we have wide variations between boroughs, from relatively high levels of physical activity in Lambeth to lower activities in Newham. We know that lower levels of activity are concentrated in the west and eastern parts of the city. And as a region, we have the lowest levels of physically active children and young people. And there are a number of reasons for this. We know that physical activity levels vary according to levels of disability, your socioeconomic status. It varies across various racial and ethnic groups. So as we are thinking about restarting and recovering and rebuilding our physical activity programs, addressing those inequalities will be key. And this issue about deprivation is really at a core of some of the inequalities we see. If you are living in more disadvantaged areas and parts of the city, then you're less likely to be physically active. You're less likely to benefit from the range of positive outcomes that physical activity brings, you're less likely to feel empowered to use physical activity services, including council-run facilities and community sports. And therefore, as we rebuild and reactivate, ensuring that we are focused on addressing inequalities upfront as a key part of what we do will be important. Finally, I always talk about physical activity as being one, not just for young people, but it's important and in fact essential that we promote physical activity across the life course. And the reason is that we know that physical activity has benefits for a range of conditions, including reducing mortality, tackling cardiovascular disease, tackling cancer, improving mental health, and of course, addressing dementia. And the benefits of muscle and bone strengthening activities really are seen throughout the entire life course, whether it is as a young person strengthening bone and muscle gains, and to older people strengthening balance and maintaining independence. So our work to really tackle physical activity and improve it across the life course will be key. Now, in closing, I wanted to just reflect on pulling this all together. We've been through 20 months of the pandemic. We now have an effective vaccine. We now understand the importance of addressing inequalities, of getting people physically active, and the importance that that will bring as part of the recovery. What are the opportunities for us moving forward? How do we take our work or learning at scale to ensure that we have the health impact at the population level? Well, one big opportunity is the transformation of the public health system, which is currently ongoing. And many of you are aware that there has been a new Office of Health Improvement and Disparities, which has been created. Public Health England will cease to exist at the end of September, and many of the health and well-being, health improvements and disparities activities will move into the Office for Health Improvement and Disparities. Now, this office is going to be in the Department of Health. It will be a powerful presence at the heart of government, working not only in the Department of Health, but working across government to promote prevention, well-being, and health, and hopefully enabling more joined up and sustained action between national and local government and cross-government activities. And I'm committing to you that we will be working with government partners to see how and what are the opportunities for improving and supporting community sport and physical activity. What's also been important in the new transformation of the health and care system is that health and well-being is now seen as a fundamental duty of all of the new organizations which are being created. So whether it's the NHS, whether it is the creation of ICSs in the NHS, the UK Health Security Agency, and of course, the Office for Health Improvement and Disparities, prevention must be a key part of what we now do to ensure better health for everyone, improve quality, and ensure we have more sustainable use of our services. We need to ensure that we're building in the lessons that we learned from the pandemic. I've reflected on some of these already, whether it is the digital transformation and engagement, the use of technology, but also some of the values and the ethos that we also learned throughout the course of the pandemic. The importance, for example, of not just taking off body parts and dealing with them, but looking at people in their entirety, that whole person approach to health promotion, which we certainly was drawn to the forefront during the COVID pandemic. People were more than their COVID risk. Their housing, their jobs, how they engage with their local communities were equally important to what they did and who they mixed with. And therefore, as we emerge from the pandemic, that whole person approach to both physical activity or mental, physical, and social health will be key. We learned about the importance of being targeted, personalized, and tailored, so not one size fits all. And although the investment upfront to meet communities where they're at and to deliver programs that are meaningful takes harder work, in the end, we know that it creates greater dividend. dividends. And then finally, ensuring that we're seamlessly integrating the digital offer with the physical and in-person offer. We've learned to do that over the past 20 months. And I'm keen to see how your sector does that integration of physical activity. So when people leave the basketball court or the volleyball court, how do we continue that engagement with them online? And what sort of additional support do we have to link people who are physically active or inactive to their mental health services, to social connections, to volunteering within local communities? So we begin to build an ecosystem of well-being in which physical activity and health are a key part of what we do. So in closing, colleagues, it's been such a privilege to be here with you today. It's a joy to be able to reflect on something which is not solely focused on COVID, which has been such a dominant theme for us as we've navigated the pandemic of the past 20 months. We are not yet through the pandemic, but my goodness, we now have the tools to help us to bring this pandemic to an end, from vaccination to prevention to all of the lessons that we've learned. I end as I began by thanking all of you for your work and your leadership. We couldn't have got through the pandemic without you taking care of us in our communities, ensuring physical activity and sports activities continued, and that you're part of the rebuilding and the re-energizing and the reactivating of our city. Thank you, thank you, thank you. And let's use all of the new changes which are happening to create something new, more powerful and more impactful for everyone's health. Thank you so much. And Georgia, Jeanette, back to you.
Thank you so much, Professor Kevin Fenton. I've got questions for both of you and Councillor Georgia Gold as well, from the delegates that have been sending them in. And remember, if you have got a question for any of our panellists, please do use that Q&A function that you see there on the platform. Just type it in, just go for it and talk amongst yourselves as well. It's really important that we get as much across to our panellists as possible. So the first question I've got here is from Neil Taylor, and Neil is asking, one of the main barriers to accessing local leisure facilities is affordability, especially for women. And what do you think can be done to support families to access these facilities? I think, Councillor Georgia, that's a good one for you.
Thanks. I mean, I think that it's everything we can do to ensure that we have schemes across all of our leisure facilities that are subsidised or free offers for members of our community who can't afford to use them, I think is critical. And I think the business model of every local authority is to try and have some full price facilities that subsidise those who need that support. So I think that's one thing. I think the second part is to make it a lot easier to use open facilities in our community, whether that's kind of special sessions in some of our green gyms or green spaces. I think during the pandemic, one of the things that we did particularly for families and mothers and families was to give people the opportunity to use our leisure facilities that had to be closed, but for those who really needed that support, and also to provide those kind of community-based exercise classes. So as I was saying in the talk, I think we've got over 300 kind of local providers in Camden, and that includes some kind of local dance classes, different community-based offers that don't need a lot of equipment, can happen close to people. So whether that's a tenant hall, a community centre, a green space on an estate, I think ensuring that there is a really accessible offer close to people. And then I think the question was particularly about women, and that there is an element of childcare. So I know that one of our facilities in Camden offers classes for children and then for mums or dads, but that for parents at the same time. And so you give people the opportunity to when their children are having a free offer to themselves, get involved in physical activity. So I think it's a mix of ensuring that there are subsidised places in some of our kind of big leisure activities, sometimes women-only sessions for those women who feel need that privilege, and then having a community-based offer really close to home. I think using some of the innovation of the online classes that have helped some people who will have childcare means they struggle to leave at home, that some of that continues, and we still give people that offer at home.
Brilliant stuff. I've got a question here, Professor Kevin, that I think would work quite well for you. It's from Dennis. What examples of NHS primary care networks working with local authorities and public health could you share with us today?
There's so many, and thank you for that question of where NHS is working with local authorities to promote physical activity. One of my favorite ones is a program called Dance to Health, which is a collaboration between, in different parts of the country, is a collaboration between a voluntary sector organization commissioned by the NHS and local authorities, where we use dance, especially with older people, to become more physically active. And the dance is so designed to do both muscle strengthening and balance strengthening. It has been shown to reduce falls and to have huge savings both for social care and the NHS. But there are also many other opportunities, especially as we develop the new ICSs and as we have borough-based boards, which are taking a more holistic view to integrating health and social care and having public health being part of the mix. So we're tackling health problems, not just by thinking about clinical services, but thinking about some of the community infrastructure that we have in place, and a recognition by the NHS that alongside investments from public health and social care, investments in the physical activity architecture can really help to reduce some of the burden, both for clinical and social care in the future. So I'm using dance as a particular example, but I know that there are many other examples where that investment and the realization of upstream investment in physical activity is key. And I'm sure Councillor Gould has lots of examples from Camden as well. Thanks.
Professor, I've got a question here from Julie Colville, and Julie wants to know, what do you know about new trends and hybrid leisure fitness models for activities in green spaces? Is that something that is looked at when you're sitting down in meetings, Councillor Georgia?
Yeah, we in Camden, we actually applied a few years ago for some national lottery funding to try and to do exactly that, to open up our green spaces, not just to be places that people can come and walk, but to really use them as spaces that foster physical activity and support people to get more active. And so I think that's a whole range of different projects that sit within that. It's having we've really seen, not through this work, but also more broadly, the importance of community champions, local people who are embedded in communities, who can talk to people about opportunities, whether that's a walking club or as people are going using a green space, talking to them about how they can run classes in that space and use it differently, but also putting in new facilities, whether that's outdoor gyms or skate parks or spaces for football and other team sports. I think all of those together are really critical. So I think we started that just before the pandemic and tried to continue some of it through. But I think it's going to be a kind of key area of focus, certainly for Camden. And I know, talking to other leaders, it's something we want to learn from each other. And I'm a trustee of the Royal Parks as well. And I know in terms of our strategic conversations, thinking about those huge cultural and community assets that we have in the Royal Parks, is something we're actively thinking about, from small local fun runs to some of the kind of bigger events that you can run in those spaces, how we activate all of those and ensure that every part of our community feels comfortable to use those spaces and that they're really for them.
I've got a question here from Sarah Bainbridge, and it's an interesting one because it says here, given the long time frame for the return of investment on physical activity and the difficulty of proving that you've actually prevented something, how do we make a case for that investment, You know, Professor Kevin, we speak about so much that hangs around physical activity and what it means and why we should do it. But how do you make the case? You know, what's available for people to be able to go out there and get the investment and say, this is what needs to be done?
So I'm going to challenge the sort of concept of the question that, you know, we have to wait a long time to see the benefits. And I know most people here are listening will be physically active, and you know that immediate return on investment, both on your mental health and just feeling better because you're exercising, takes place very, very quickly. So the evidence is there about the power of physical activity to have multiple improvements and multiple effects, positive effects on a variety of outcomes. And one of the slides I showed those benefits. So I would encourage you all not to try to relitigate whether or not physical activity works, yes or no, because we have really good evidence that it does. And we also have evidence about the early term impacts on our mental health and well-being as well. And I think building the case for strengthening your community sports as well as physical activity programs, I would encourage you to think about the opportunities as we emerge from the pandemic. So how do you ensure that your physical activity programs are not just focused on physical activity, but some of the other needs of councils and the NHS? How do you build social cohesion? How do you tackle isolation? How do you develop your physical activity programs so you're linking people into, for example, health checks or appropriate health and care services? All of these ways in which you find the ways to connect your physical activity programs with the needs of the NHS and social care will be key. And second, how do you demonstrate that your value for impact is increased by doing things differently? One of the problems that we've had historically with a lot of community sports programs is scale. That, you know, we do interventions. Yes, we may have 20 people coming to a class every week, but in a borough of 300,000 people or in a borough of 20,000 people who are over 65, how do you deliver your programs at scale so you're helping to improve population health? And that may be a hybrid model of digital and in-face provision. It may mean thinking differently about how you design your programs. But those are two examples of ways in which I think we need to work together to think differently about our physical activity and sports programming so that as we move into this new phase, we're really yielding the benefits of it at scale. Thanks, Jeanette.
More question from the delegates that have been sending them in. They're coming in, and this is from Dermot Collins. And Dermot's saying, does offering free access to local authority facilities bring about a response from groups that have currently considered to be inactive? He says, I believe that Southwark have tried this approach. Is there anything out there at the moment, Georgia, that can add to that?
Yeah, I think that's definitely the case, and we in Camden, I actually had an email from one of our care leavers the other day because saying that for whatever reason we'd ended up the free offer that we had for care leavers had ended up stopping during the pandemic, and saying what a huge difference that had made to them, and so it's something that we're introducing at the moment. And I think that it's often the start of a journey for people, that free provision. I think for some young people who haven't used those services before, even a tiny bit of money can be a huge barrier when you're facing huge deprivation. So a kind of free offer at a certain time is a huge opportunity. There was some work, I can't remember where it was, that a borough did, which was giving people a free offer, but quite an early time slot. And I think that routine really helped to get young people using different facilities and starting to get that kind of day-to-day routine started. So I think free provision is amazing. Obviously, there is a huge financial pressures on the sector. So I think we have to think really strategically about ensuring those who most need that free offer have that access, and that we can provide as many subsidies as possible for different parts of the community. But we definitely hear when we talk, that kind of deep work and the community-based work that money isn't the only barrier. It can be intimidating going into a kind of big leisure offer if you've never done something like that. And as I said, I walked around the block to avoid it myself. And I think that it as well as offering free provision, I think offering community-based provision, working with people to really understand what's important to them. And for some people, it actually isn't a kind of a gym environment. So some of the work we're doing around active gardening and different kind of models that work for different people. So a kind of diversity proving critical, but yeah, free provision should definitely be one of those levers and one of those offers we have to encourage people to step into leisure for the first time.
Councillor Georgia, Professor Kevin Fenton, thank you so much. And I'm hoping all of you who are listening have had some food for thought there in terms of how the recovery efforts are centred around sport and how in London we can make sure that that is a priority. So thank you very much to our panellists. Coming up in about 10 minutes or so, we're going to be highlighting our young people. What are we doing with the young Londoners in making sure that they have got the access to sport, and what does the role of sport and physical activity play when it comes down to young London? So that's coming up in about 10 minutes or so. So I implore you, go and get yourself a cup of tea, whatever you need, a biscuit to make sure you're energised, or a good glass of water, a bit of lemon actually, that would help. And make sure you join me here, and that will be in about 10 minutes or so, and I'll see you then.